Welcome to Ideagen TV. Today we have with us Dr. Rhonda Medows, President of Population Health at Providence, and also CEO of Ayin Health Solutions. Dr. Medows, welcome.
Thank you, and good morning.
Dr. Medows, it's such an incredible time for a lot of different reasons, and I put incredible in sort of a quotation. We are at a crossroads, at a moment in time when we are all, going through the global pandemic. And I'd like for our global audience to hear from you today, beginning with a little bit about yourself and your role and responsibilities at Providence.
So, thank you, George. I'm a family physician by training and a mom by just natural inclination and virtue. But I serve at Providence as the President of Population Health Management, as well as CEO of Ayin Health Solutions. Ayin Health Solutions is our population health management company, where we provide the services that we have improved upon and had success with within our own delivery system. And we provide those to other health systems, payers, employers, and government programs. Population health for us means focusing on the individual populations that we are serving, regardless of their location and our 7-state footprint. But it also means that we give additional attention to those populations that may need additional assistance. That includes not only the Medicaid populations and indigent populations, as well as the elderly in Medicare programs or dual programs. It also includes addressing mental health and a whole host of other things, including, more especially right now, health equity.
And Dr. Medows, that's such an important role that you're playing to help change the world in so many ways. And your perspective as a global leader in healthcare has been recognized by so many organizations along the way, rightfully so, because your vision, your ability to peer and to see around corners is so critically important, especially as we talked about at the beginning of this program, where we're at this crossroads. We're at a moment where the light is shining, and we'll talk more about this a little bit later, but is shining on health disparities, not only in the United States, but really across the world. And at Providence, you've been using innovation in such positive ways to help achieve many of the global goals of the UN, but specifically goal number 3, such as helping to reduce avoidable emergency department visits, etc. Can you help explain to our global audience how you and your team have even begun to do this?
When we are thinking about good health and well-being, we think about the whole person. And we also think about those people who actually, again, need additional assistance and support. The only way that you can actually know where to even begin the work of making sure that they get better health care delivery and access is to begin understanding the populations. So we do the work within the Population Health Management Division, focusing on learning, or as I say, knowing the populations, and then actually doing the work of taking that information, the data, the analytics, predictive analysis, and then working with that information to inform how we would intervene. So when people say, well, you've done a great job in reducing avoidable emergency room use, and that means actually having people not be in the emergency room if they don't necessarily need to be, and giving them alternatives upstreams so that they don't actually even have to consider that as an option. So that means actually knowing the population and anticipating their needs, and then doing upstream work to give them solutions and services. It could be anything from telehealth. It could be actually making ourselves available through nurse lines or telephonic care managers. It could actually mean anything from even meeting them in the emergency room and actually showing them the access that they can receive care and alternative sites. Now, because we're in the middle of a pandemic, a lot of what we do is actually telephonic and telehealth, which actually is more convenient for quite a few people. The work to actually reduce avoidable EDUs starts with actually understanding the population, providing information, health and well-being services through alternative methods at home, digitally, using the expanded use of technology, and other services and partnerships. Sometimes it actually means making adjustments and actually supporting those services that can help with the incidents or the things that actually contribute to feelings of illness or well not being well. So we can address things like nutrition, housing, homelessness. We can do those type of things up front. We can actually provide services in coordination with school districts. When we were in school, when people actually were attending classes before the pandemic. Now we do, again, a lot of work through community partners to provide alternative services. And we find out we have people who then don't need to go to the emergency room as much for the routine care. For true emergencies, we want them to come into the emergency room, no doubt about it. People having symptoms of stroke, heart attack, etc., still need to come into us, but we show them a better and safer way to access care.
You know, that is a description of leading and leadership. And you're also helping at Providence to drive population health strategy. What does that look like?
You know, every place that you go has a different definition of population health. For us, it literally means knowing the populations first. It literally means taking the wealth of data that we've already collected on our patient populations and on our health plan populations, identifying those people who, again, need more advanced or more coordinated care. So if we have individuals who we know have chronic conditions, multiple medications, and then also have social circumstances that impede or provide a barrier to them actually having health and well-being and access to care, and we actually intervene ahead of time. For us, it means having a partnership. We have a system-level population health leaders with expertise, experience. We leverage all of the data that we actually have and the advanced analytics. And then we actually make sure that we leverage our size and scale to procure or to arrange for resources. At the local level, our local leaders in population health are multidisciplinary. They're experts in their community. They know which partners to actually address. They actually know which people in the communities actually need additional assistance. Putting those two together means that we take the best of both worlds: system expertise and resources, and then the local community knowledge and information about what's needed locally and what's going to be impacted.
You know, these are incredible and very inspiring perspectives that you bring to Ideagen TV, and especially during these times, as we mentioned, during the global pandemic. During this pandemic, Dr. Medows, we've seen a spotlight, a bright light on health disparities, again, not only in the United States, but across the planet. And, you know, as an expert, as someone who's on the ground, who sees the entire process, the entire continuum in healthcare and in healthcare delivery, what do you see as the best approach to dealing with these disparities, including racial disparities in the delivery of healthcare?
So, George, the COVID pandemic basically amplified long-standing health disparities that have been present for hundreds of years and have been measured excessively for many, many decades. So we know that this is not only not something that's new, we simply know that it is amplified and just basically made the tragedy even worse. What we did in order to actually make this very real and something actionable for us was to look within our own patient populations and confirm what everybody else has seen across our own country and globally. Higher rates of morbidity and mortality, anywhere from 3 to 5 times mortality rates due to COVID in the African American, Hispanic, and Native and Indigenous populations. What we did was take that information to each of our local community leaders, meaning the Providence healthcare delivery system leaders, as well as people in the community that they partner with on a regular basis. Partners who work again in some of the social services areas, including nutrition, homelessness, and everything from education to making sure people have utilities turned on, and as well as transportation. When we did that, we basically asked people to not get so overwhelmed with the enormity of the long-standing health disparities, but to think tactically about what we need to do right now. This pandemic is still continuing. We still are losing people avoidably, I believe. And if we actually were to intervene now, we could actually reduce some of the harm, some of the morbidity and mortality. That includes just 5 basic, straightforward topics that sound basic, but they require us to get up out of our seats and actually do it. The first is actually going out into the communities that are impacted, and actually making sure that they have the information, resources, tool, and know how to access the information as the information evolves. And that may seem very simple to you, but that is not sending an email or leaving a voice message. It means actually engaging with people in the communities of color. It means everything from literally pitching a tent to bringing a mobile van to going to community centers to actually meeting with community leaders, and doing so, of course, using the prevention and the protection measures that you're supposed to be doing, basically masks, social distancing. The second is actually bringing COVID testing into these communities. Early on in New York and on the East Coast, you heard about delays in testing as well as test results. This was even more an impact in communities of color, where the test kits didn't even arrive until well after other people have already begun testing. So making the testing readily available in the community within walking distance of where people live made a huge difference. The third is making sure people actually know how to access care and when to access care. That could be either telephonic or digital, as we talked about before, but it can also mean understanding when to come in and call for emergency services when symptoms are worsening due to COVID. The fourth is actually making sure that we are doing what we believe that we might be doing. So when we talk about having equitable access to new medications and treatment that actually are used to treat COVID today, we need to basically check ourselves and make sure that that actually is occurring. So has remdesivir been fully available to any and everyone who meets the clinical criteria in a hospital setting? And then finally, vaccines, when they have been made available and they are proven safe and effective, making sure that we prioritize the people who actually are at higher risk for morbidity and mortality, which is people of color, along with people in nursing home, the elderly, and we also want to always protect our frontline and first responders.
Incredible leadership again on looking at the process and the people involved in the process, and including really what a lot of folks are speaking about and referring to today, which is that empathy piece. I think the empathy piece is critical when making these decisions on how to help address really disparities across the planet. And you're doing that, Dr. Medows. Clearly, it's incredible to see and to really understand the breadth and depth of the impact that Providence is having with your assistance and leadership and insights and just your overall leadership on this. How have you seen Providence adapt to this pandemic in terms of innovation and process?
Well, George, Providence actually had the first case of documented COVID back in February. And when that occurred, we immediately had all hands on deck. But what ended up happening was we recognized, I think, early on the need to change how we not only deliver care, but also how we operate and how we move about and actually work with each other as well as people in our community. So when I say that, I mean the changes that have occurred change everything from how our facilities are set up and make sure that patient safety and well-being, as well as the safety and well-being of our frontline caregivers, is preserved and protected, to actually operating differently in our ambulatory care centers in the lower acuity places of care. It actually included exponentially increasing the amount of telehealth. Telehealth has been embraced not only by our clinicians and healthcare providers, but amazingly so by our patient populations across the board, young and old, have adapted it. Our administrative and operating type caregivers have actually focused more on adapting to telework. And that has actually gone really, really well. It is not something though that is just haphazard. It's something that you have to work at. Again, making sure that people actually still continue to see themselves and perform as a team, that they stay focused on the mission at hand, and that their own mental health and resiliency is strengthened through the process of making a major change in how they operate. So we've incorporated different safety protocols and procedures. We've actually improved how we operate not only in hospital facilities but in nursing homes as well. A major place where concerns of increased morbidity and mortality is known to occur. We've made massive improvements and not only anticipating, but also then planning and implementing supply chain improvements. And we've also done the work of making telework really work really well for us. Overall, it's actually made us better, stronger, and more effective.
Well, therein lies the story. It's incredible. You've had the first COVID patient. I recall I was in Seattle when that was all transpiring, and it was, in the news. And to think that just a few short months later, the entire planet would be experiencing, perhaps for the very first time in human history, the same exact, effect from this pandemic. And so I'd like to shift a bit. We've spoken about the pandemic, but I'd like to ask you, Dr. Medows, what would you say has been the most rewarding moment for you and Providence as we've adapted, innovated, et cetera, and why and what has made it so rewarding?
So, George, I have to tell you that with the work that we normally do, and normal being a questionable word at this point in time during the pandemic, recession, et cetera, but within the work that we normally do in our official full-time jobs, there is something that I observed that we did really, really well as just regular people working in our communities. So going above and beyond in the middle of the pandemic, from the early months and all the way up until today. And what I'm talking about is the people who volunteered to do things in their communities to help populations otherwise that may not have been served well, that are traditionally marginalized. That actually, to me, has been the thing that actually I'm most proud of when I think back to what we've accomplished. That includes actually the people who volunteer, not only their time, energy, and funds, but really went out there for arranging for our homeless shelters in each of our states to actually receive, again, not only the funds, but understanding the timing of getting them cleaning product, hand sanitizers, masks, and doing it early enough in the pandemic itself to make a difference. We were really concerned that people who were living in homeless shelters, who were living on the street, would not receive not only information, but basic resources needed to keep themselves healthy and to reduce viral transmission. And so the people who volunteered to do that work are phenomenal. They have their regular job, they have their families, they have their usual commitments, but they volunteered to get those resources there and then work with the community leaders who were distributing them. The same thing is something that we did with food banks in Washington State and California. Again, if you think about it, there are people who have no choice but to depend on food banks for their daily sustenance. They cannot survive without that. In order to keep the food banks open, operational, and providing services, the people who volunteer there need masks, disinfectant, cleaning supplies, etc. And the people coming in to receive food need the same thing, in addition to information, basic soap, knowing where there's access to water. I mean, so all of those things come into play. I'm really proud as most of the people, not only in the Population Health Division and Providence Health Plan, but other volunteers as well across Providence, their families, my family, who all came together to do that effort and to still come back and say, what do we do next? What's the next thing that they need? What's the next step? So this is still ongoing, but I think it shows us who we really are at heart.
That's right. Exactly. And during this time and during these times in general, I think the ability to develop and to recognize the importance of that impact is vital for the future operations of any organization. And I'd like to applaud you and Providence on the partnerships that you've created over the years that not only are important today and perhaps critical today, but that looking around the corner, the ability to see around corners that you've had and that Providence has enabled Providence, I believe, to accelerate the impact despite the pandemic. In other words, you've had these partnerships, you've implemented opportunities to work with other organizations because obviously we all recognize we cannot do it alone. And thus, you've been able to have such a greater impact than other organizations who may not have been focused on creating partnerships. And today are trying to create those. And as we all know, developing partnerships when you have lockdowns and inability to meet, perhaps even in person, is much more difficult. And thus, that goes back to the resiliency aspect that Providence has been so adept at. Resiliency and impact combined with leadership, I think, is an incredible recipe for success, which is a perfect segue to what I know you believe in strongly, which is cross-sector collaboration and innovation. And so, Dr. Medows, why do you believe, and I know the answer to this, but I'd love our global audience to hear from you again on this. It's so important. Why do you believe that cross-sector collaboration and innovation are so vital to helping to solve so many of the world's most vexing issues? And perhaps to go a bit further, how do you infuse collaboration into your daily mission to successfully achieve your goals at Providence?
So, George, you're right. You probably do know exactly what I'm about to say. I think there's an arrogance that it would be our downfall if we assumed that we alone had the sole solution, or that we could actually solve all the problems that a community, a family, or an individual needs. Our collaboration has been with big organizations, and so Microsoft, Amazon, Google, but it's also been with startups that have amazingly young talent with new ideas, fresh concepts that have actually pushed us along the continuum of using what we had and making it even better. And then we have partnerships with people and organizations who do all kinds of sorts of things that, if you think about it, just really think about it, makes a case for why it's really important to look beyond when people become ill and then need services, but go upstream. How do you keep them well? How do you keep them safe? And how do you anticipate what they might need and jump in ahead of the game? So that means everything from partnerships with local farmers markets and grocery stores for nutrition. And so now during a pandemic and a recession, it becomes really important to make sure that we amplify their work in terms of providing nutrition to people right now. It means working with small businesses and making sure that when there's an opportunity to foster their efforts to bring people in, either as volunteer or as for temporary work or something along the way to help people and families sustain themselves. Whether it's working with a whole host of technology, medical device, but also social services, right? How do we intervene and actually help amplify the word about mental health services, group therapy online, substance use, making sure that people understand that there are alternatives now, and then helping them build out resiliency for the people in our own communities. All of that stuff adds up, and it actually doesn't produce success unless we are doing it together. I think we have all kind of gotten over ourselves in terms of thinking that we are the end all and be all. It only actually works when we are all rowing in the same direction. So I'm hoping that's what you were asking, but I think that that's what the answer should be.
Well, and it is, and I had a sense that you would go in that direction to talk about all of the incredible aspects of your work, including your steadfast belief in partnerships. And that is, I think, an important element to all of this. Dr. Medows, we've heard from you at Ideagen, especially at the United Nations a few times, and you've inspired so many with your commentary and your insights and your leadership. I'd like to ask for our global audience, for the millions of people that will see this interview, what are your 3 key pieces of advice that you would provide in order to help us gain perspective on how we can achieve the global goals by 2030? We're in the midst of the pandemic. We know where, at least have a better sense of where the disparities are in the world. The global goals are a great unifier, agreed upon by all 193 member states. Hasn't happened often, if ever. The United States is a signatory to that. So I like to think they're apolitical in a broad sense. And I'd love to hear for our global audience what your perspectives would be in terms of 3 key pieces of advice leading into 2030.
So, George, I would have to say that for everyone everywhere, the 17 goals actually outline where we strive to be and where we need to be. When you look at them individually, ending poverty, ending hunger, gender equality, economic opportunity, all of those things, environmental stewardship, right? All of those things, when you look at them, each one is massive and enormous. I would probably say that the first word of advice is to look at opportunity or goal number 17 that speaks about partnership. Because the number one thing is to realize that you're not in this alone, and to take that opportunity to work in partnership and collaboratively with others. You cannot achieve all of these by yourself. You may not even be able to achieve one of these by yourself, but the idea is you can do that, though. We can be successful as partners in doing that. The second thing is to don't underestimate your ability to make some measurable impact. You can actually do this. So don't let the enormity of the challenge of the goal stop you from trying consistently and being persistent. My name is Rhonda Michelle Medows, but I've switched out Michelle for tenacity. That's how we actually get things done, is remain persistent and doing what we are able to do and continue to expand through partnerships. And then probably the next piece is we always think that more is better. And you would think that that would be the case, but sometimes doing less is better. Less regulation, less rules, less old process that may be outdated. So sometimes we have to look at what we already have on the table and realize, well, maybe that wasn't as effective. Maybe that's a barrier. Maybe that's posing another challenge to an already difficult or challenging goal that we have to achieve. So those 3 things. Partners, don't underestimate yourself, and reevaluate. Is more really better? And should you be doing less of some other things to help us achieve our goals?
That is profound. Dr. Rhonda Tenacity Medows, I like that description and the roadmap that you've provided our global audience at Ideagen TV to be able to believe and to really understand beyond believing that one individual can make a difference. We see it in you. You're making such a difference for so many people across the world, literally. It's not just talking, but it's also walking. And you're leading people, and you're helping to guide, and you're helping to help break down what would be an enormous, just absolutely enormous change in the delivery of healthcare, and changing that paradigm so that people can understand that, like you said, sometimes less is more in regulations or in ways you're doing something. And I think maybe that's one of the, if we can talk about some of the positive elements coming out of the pandemic, is that we're able in some ways, Dr. Medows, to rewrite how we work, how we live, how we play, how everything happens, so that maybe there's more efficiency. Maybe some of the things that were happening didn't need to be happening, just based on the fact that things have changed and innovation is accelerating. And it's that incredible moment in time where innovation can take place and we can come back better and we can go forward, to your point, forward, stronger and more efficient. And so we're at the conclusion of our interview on Ideagen TV, and I'd like to ask you a final question. And that is, what would be your post-summit ask for our global audience as we continue to change the world together?
My ask, I think, would be that people not only increase their own personal and professional resilience, but that they spread that by encouraging not only their partners, colleagues, coworkers, and families, but the next generations coming up behind us. They are moving out faster because of the pandemic, because of the recession. So my ask would be to make sure that they are bringing younger people, younger talents, going all the way back to high school, college, to the interns. Bring them to the table sooner, quicker, faster. They have a voice, they have things and ideas to share. And honestly, they're going to be the ones leading us sooner than we think. That would be my first and foremost ask.
Dr. Rhonda Medows, Providence, leadership defined. Thank you for the inspiration. Thank you for your leadership. And thank you for your incredible insights today.
You're welcome. Thank you, George.